Welcome to This Explainer. Today, we're digging into a vital report for the Rehab Haven Rehabilitation Center, and we're exploring the really profound science and practice of stroke recovery. You know, if you or a loved one has gone through a stroke, it honestly feels like your whole world just stops. But as our sources show us today, recovery isn't about looking back and grieving what was lost. Instead, it's this incredibly active, dynamic process of rebuilding what can still be. We're going to look at the brain's amazing capacity to heal, the steps you have to take to maximize independence, and the specific ways families can actually drive recovery right from home. Let's get right into it. Recovery from stroke is not a return to what was. It is the construction of what can still be. Okay, I absolutely love this quote from Dr. Joseph Nyamwa. It perfectly sets the tone for everything we're covering today. See, often when we think of healing, we picture returning to the exact way things were, right? Like a cut on your hand that just fades away and looks totally normal again. But a stroke is completely different. Dr. Nyamwa brilliantly frames the adult brain as a resilient construction site. When a section is damaged, we don't just abandon the project, no. We bring in new blueprints, we reroute the wiring, and we construct a totally new, highly functional reality. Section 1. The brain's healing power. Let's get into the biology. To kick things off, let's test your knowledge for a second. We know the brain sustains damage during a stroke, but how exactly does it recover those lost functions? I mean, does it grow back the exact same damaged cells? Does it just bypass them completely? Take a second to really think about the actual physical mechanisms the brain uses to heal itself after such a major injury. Well, the master answer here is neuroplasticity. This is the ultimate biological tool we use to construct a new reality after a stroke. It basically means the brain isn't hardwired or permanently fixed like a computer's motherboard. Instead, it is incredibly flexible. Even way into adulthood, your brain retains this astonishing ability to reorganize its structure and its connections. When an injury strikes, neuroplasticity is the literal engine driving every single piece of recovery we see. And it's not just magic, right? It's mechanics. Here's how the brain actually rewires itself. First up, we have the resolution of Diaschisis, which is really just a fancy medical term meaning that remote, undamaged areas of the brain that were temporarily stunned by the stroke suddenly wake back up. Then, the healthy areas right next to the stroke, the perilesional areas, they actually reorganize to take over the jobs of the lost tissue. Even the opposite, totally unaffected side of the brain can pitch in and compensate. And finally, through axonal sprouting, the brain literally grows brand new synaptic connections. It's just amazing. Moving on to Section 2, the rules of effective rehabilitation. Now, the crucial point here is that rehabilitation only works when it strictly follows a specific set of building codes. First, it has to be early, starting within 24 to 48 hours once the patient is medically stable. Second, it must be intensive. We're talking high repetition. Just doing a movement 5 times, that's not going to rewire the brain. Third, it needs to be task-specific, which we'll dive into in just a second. And fourth, it must be sustained. Neuroplasticity operates on a timescale of months or even years, not days. Sticking with it over the long haul is absolutely key. Section 3, the stroke recovery team. To pull all this off, a patient needs a highly specialized crew. Optimal recovery requires really coordinated expertise across the board. You've got a physiotherapist for mobility and balance, an occupational therapist to help you regain the ability to do daily things like dress and feed yourself. A speech therapist is vital for communication and, critically, safe swallowing. And a psychologist addresses the heavy mental toll of the event. Superior outcomes happen when all these disciplines work together, not in isolation. There's a massive difference between simply moving a muscle and engaging in task-specific motor training. Generic exercises, like repeatedly lifting a small weight, are fine. But task-specific training is where the real magic of neuroplasticity happens. Practicing the actual, functional activities you need to regain, like reaching for a specific cup or standing up from a chair. And doing that hundreds or even thousands of times, that is what actually convinces your brain to rewire those specific neural pathways. Beyond that, physiotherapists rely on some core evidence-based interventions. One of the most fascinating ones is constraint-induced movement therapy, or CIMT. This is where therapists will literally constrain the healthy arm in a mitt or sling for most of the day. Why? Because it forces the brain to use the injured arm. It is tough, no doubt about it, but it forces that neuroplastic reorganization. They also focus heavily on gait retraining to get you walking again, managing spasticity, which is that tight, stiff muscle tone, and falls prevention, because stroke survivors have a dramatically higher risk of falling. Section 4, Overcoming Challenges in Ghana. Now, we have to talk about the reality on the ground. Patients and families in Ghana frequently face some really stark systemic roadblocks. There's limited inpatient capacity, which means patients are often discharged early without enough follow-up care. Add to that the geographic distance to specialized centers, financial hurdles, and the immense burden placed on family caregivers. It's an enormous missed opportunity for recovery if we only rely on the traditional hospital model. We absolutely have to find creative, community-centered solutions. Section 5, Home Exercises for Caregivers. If you're listening to this as a family member or caregiver, this next part is a critical transfer of power. It gives you the exact tools to help rebuild your loved one's independence at home. You don't have to feel helpless here. You can actively drive their neuroplasticity. So, here is your daily building plan. First, passive range of motion. You manually move the affected joints through their full range twice daily. Second, active assisted reaching. The patient tries to reach while you assist them for 20 reps. Third, supported sitting balance, building up that core strength for 5 to 10 minutes. And finally, sit-to-stand practice from a firm chair. By systematically and safely practicing these exact functional movements, caregivers literally become the essential engines of the patient's recovery. Also, as part of home safety, you have to be acutely aware of dysphagia, which means swallowing difficulties. This affects up to 70% of acute stroke patients, and it's a major cause of aspiration pneumonia. That's where food or liquid accidentally enters the lungs. Before trying any oral intake, a really simple bedside water test, giving just a teaspoon of water and watching for coughing or a wet-sounding voice, can quite literally prevent a life-threatening complication. And our final section, preventing a second stroke. A stroke isn't just a medical crisis. It's a massive, blinking warning sign. Stroke survivors face a staggering 10 to 15 times higher risk of having a recurrence in their first year compared to the general population. Think about that. That's a monumental risk, and it means that physical rehabilitation is really only half the battle. Prevention is the other half. To prevent that recurrence, an exact medical and lifestyle management checklist has to start during admission and continue indefinitely. We're talking strict blood pressure targets, keeping it below 130/80, the use of antiplatelet or anticoagulation therapies depending on the type of stroke, statins for anyone who had an ischemic stroke to help stabilize vascular plaque, and, of course, strict diabetes management alongside intensive lifestyle changes. You just cannot leave these things to chance. We also cannot ignore the mental toll. Post-stroke depression affects 30% of survivors. 30%! That's a massive number, and it's a biological and psychological reality of brain injury. If it's left untreated, depression severely impairs physical rehabilitation outcomes and even increases mortality. Mental health screening and treatment are honestly just as critical as managing your blood pressure. So if you're a stroke survivor or you're caring for one, I want you to ask your healthcare provider a crucial question today. Are your medications, your blood pressure, and your cholesterol actively at target to prevent a second stroke? You have to be your own advocate to protect the incredible work your brain has achieved. And it leaves us with this really profound thought. If the adult brain has the physical capacity to literally rewire and rebuild itself after such catastrophic devastation, what other untapped, incredible potential are we carrying around in our heads every single day? Thank you so much for joining me on this explainer, and keep building.